Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're going to talk about copper toxicity. And Dr. Prather, how common is copper toxicity?
Copper toxicity is actually a pretty common problem. They're finding about 20% of the population can actually have some copper toxicity, and which is a very high level and can have a huge effect on people's health and well-being.
What problems are associated with copper toxicity?
Well, this is something that people haven't really heard about that much.
No.
And there's a tremendous amount of literature out there and research that has shown and associated copper toxicity with actually quite a few different types of problems. And of course, copper toxicity is rather relative. Mm-hmm. You have an imbalance of mainly copper and zinc because they're antagonistic to one another. Mm-hmm. And if there's a slight imbalance, it does cause some changes in how people actually function. In extreme levels, of course, that's rare. Then you can have some pretty devastating diseases that actually occur. But one of the big things that copper and zinc ratio does is it controls the hormonal balance.
Okay.
So if you get severe copper toxicity, your hormones are off, which leads to quite a few different types of issues. There can be depression, there can be insomnia, fibroid tumors comes from copper toxicity, anorexia, depression. All those different types of things can be involved with copper toxicity. The other thing that copper toxicity can be involved in is immune system. Mm-hmm. It can also be involved in learning, ADD, ADHD. Dyslexia actually has actually been shown to be directly related to copper toxicity. With the hormones, you can have PMS symptoms, headaches can actually be associated. Also skeletal problems, osteoporosis. Severe osteoporosis can actually be associated with copper toxicity, and scoliosis.
Mm. Well, how does copper affect, let's start with, you said hormone imbalance.
Yeah, and that's a very interesting area to look at because copper and zinc are sort of like the male and female portion of your minerals.
And that's what we should talk about. Copper is a mineral, right?
Copper is a mineral, and it's actually essential for health and well-being. Mm-hmm. If you have low copper, there's a lot of things that actually can occur. You can have, again, poor endocrine function. It affects the thyroid. It can cause anemia. It can cause immune problems. It can cause hair loss. So low copper is not good. Again, one of the things that we talk about in our office is homeostasis. Mm-hmm. And homeostasis is the balance of the body. And if the copper-zinc ratio is off, then that can actually affect the hormones. Interestingly enough, if you go either way with one being higher than the other, then you can start to get certain types of effects. But the copper is actually what we would consider more the female hormones, the yin type of thought pattern along those lines.
And you're using the copper-zinc together. Why is that? Are you always looking at those together?
Yeah, you're always looking at those together because you can actually get, you don't necessarily need to be high on copper to get some of the effects of copper. Mm-hmm. Toxicity, it can just be an imbalance. So if you're very low on zinc, then you actually get some of the symptoms of copper toxicity that actually occur. But copper and zinc play a direct role in making hormones. So if you have a too high of a level, it will actually interfere with your zinc utilization to make the hormones that are actually necessary. The zinc highest concentration is in males. Males actually hold more zinc than females. And not only does it affect the hormone balance, but also even the brain balance.
Interesting. Because I know this is an issue with me. We have to, check my copper levels, and we'll talk about how you check that, but always watching the copper-zinc ratios.
Sure.
Some of the time I have to take a zinc supplement, correct?
Correct. The zinc is actually a great way to help to bring down copper levels because it is antagonistic with that. The copper and zinc ratio is extremely important and something that needs to be watched on a regular basis. If you are off, then the depression can occur. There can be all sorts of mental and emotional things that can actually be involved. Matter of fact,
we're not talking about me right now.
No, absolutely not. But I've had women come in and said, my husband said that I need to come in and get my hair analysis again and check on my copper ratios. But that is something that
we're going to pick on
occur.
men soon here.
Yes. Well, it can actually occur in men too. One of the things is high copper in a male will if they're during the maturity levels, then their tendency for scoliosis is actually higher than a female.
You mean when they're growing?
When they're growing. So one of the things that I always do whenever we're dealing with scoliosis is to always check the hair analysis and check on the copper-zinc ratio.
Now, you've been talking hair analysis.
Yes.
What is a hair analysis?
A hair analysis is probably one of the best ways to check on the copper-zinc ratio. There are actually many different types of tests that you can do, but the copper-zinc ratio in the hair analysis is probably the least expensive and the most accurate. Through experimental studies, they found a very high correlation with the problems associated with copper-zinc imbalance with the ratios in the hair. And we find a very, very definite relationship on that. As an example, we've actually seen scoliosis completely correct just by balancing out the copper-zinc ratio. We had a young girl who was going to be put on Ritalin for her ADHD, and we did the checks on her and found that she had very high copper. Started her on a zinc supplement, and Mom knew exactly when she hadn't taken her zinc. Because of the changes that occurred. And eventually she didn't need it anymore. But she had a kind of a flare-up again, and she brought her back in just recently. And the copper-zinc ratio had a huge effect on that.
Interesting. And you mentioned also a role it plays with ADD and ADHD. And that is something that's so prevalent these days.
The brain is very sensitive to zinc and copper. Matter of fact, a very interesting aspect is people who are more right-brained, more creative, artistic. They found a direct correlation that they usually have higher copper levels. People who are very analytical, very left-brained, that they're actually higher in zinc.
Interesting.
And people who are artists actually have a higher tendency towards copper toxicity than analytical types. The analytical types are more that they would actually become deficient in copper.
That's real interesting.
Yeah.
So it has a right brain, left brain correlation.
And you can actually get a balance in the brain by balancing out the copper-zinc ratio. It has not only a huge effect on the hormones, but also on the nervous system. For the emotional stability of an individual, having the copper-zinc balance in there is absolutely important.
Interesting. Well, when we come back, let's talk about how copper toxicity is treated. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. Dr. Prather, tell us why your weight loss program is unique.
Well, we're not just interested in your weight loss. We're interested in your overall health and well-being. So, again, we are an office that is looking at homeostasis within the body. And homeostasis on your fat percentage is an extremely important part because that determines a lot of your pH, your hormones. It has a huge effect on how your body actually works. So we're not just looking at, yes, we want you to lose weight, but we want you to lose weight in a healthy manner.
That you'll be able to keep it off.
That you'll be able to keep it off. We don't allow people to gain their weight back. We really try to keep up with them and make sure that they have a lifestyle that maintains their weight, their desired weight. And then we also check to see what is the proper weight that you should be for the percentage of fat. Because that is what is really important on this. And we also look at the whole person. What is it that's actually keeping you from being able to get where you want to be, whether it's emotional issues, whether it could be like we had a patient who was low iron. And that low iron was, they just couldn't lose weight until they got their iron levels back up.
Right. We see a lot of, thyroid, endocrine system.
Yeah, endocrine system that's out of balance. So we figure out what it is that's going to get you to a healthy state. And as you get to that healthy state, it makes it very easy then to lose the weight. And people are surprised at, that they're able to lose the weight and feel so much better. That's one of the beauties of all this.
And the other thing, too, it's very individualized.
Very individualized.
We have type 1 diabetics on the program. We've had people with type 2 get off their insulin.
Sure.
So with it being medically supervised and blood work is taken, so we know exactly what's going on.
Yes, we do. And that just makes all the difference in the world. And people have different types of, it's amazing how many different individual types of needs and quirks and all sorts of things that people have, and working with them to help them to get where they want to be is always a pleasure.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Today we're talking about copper toxicity. Dr. Prather, what percentage of the population is affected by an imbalance in copper?
Yeah, what they found is the imbalance on copper is about 20%. It is one of the things that we like to check on almost everyone because we do find such huge effects in people's health and well-being by actually balancing out their copper zinc. That is one of the things that you can make a quick difference in people's health and well-being.
When you mention, the minerals, people don't even think about it. We're hearing a lot about aluminum, and we've heard a lot about mercury. And, the question I get, well, where did I get it from?
Oh, sure.
Yeah.
Sure.
How do you answer that?
How does copper-zinc ratio get off? That's an important part of what's going on. Part of it is, of course, is nutritional. There are different areas where the soil is more imbalanced, whether it's high copper or high zinc. And as you get that, then there is the intake on that. The copper pipes, a very common type of thing. One of the things that is really probably one of the biggest factors is water softeners.
Oh, really?
And if you actually have a water softener with copper pipes, your chances of having copper toxicity are extremely high. Because they actually use a copper-based, I believe it's copper sulfate-based water softener, because it helps to take out the other minerals out of it.
And so you're showering in that water.
You're showering in that water. You're drinking it. But the shower is actually the most the biggest area where you get it from, because if you actually breathe in that copper fumes from the steam, then that's one of the most common ways that you can actually get copper into your system. So being, those hot showers and nice steamy and you have a whole bunch of water softener associated with that, then you can get a high levels of copper.
Interesting. Yeah, because I get that. Where did I get that from?
Sure.
It can be genetic too?
Absolutely. There are people that they have found that are just genetically predisposed to having higher copper. They're not completely sure why, but there is that whole factor. The other factors that can be involved is you could be taking a drug that actually helps to kick off copper toxicity. A lot of the hormone drugs, the drugs for hot flashes, always raises up copper levels.
Interesting.
Because that's one of the ways that you can affect the hormones. So there's a very strong effect on many different types of drugs. Antidepressants can be a big factor along those lines. A lot of the different types of drugs that you might take, even for lowering cholesterol, if it's a gut-based one, then that will actually pull copper out. Copper is usually taken down to the liver and then processed, and then the body actually excretes the copper through the gallbladder. So gallbladder problems can actually, if there's an issue associated with that, or liver problems, then you can start to accumulate copper. And that's one of the areas that copper can actually start to accumulate and cause quite a bit of damage. One of the things that if we find high liver enzymes, then we always check to see if copper might be an issue.
Interesting.
So there can be a huge amount of effects on copper and its effects on the system. Type 2 diabetes. High copper can actually cause type 2 diabetes with hypoglycemia, with spikes along those lines. So there's so many different types of areas that you can find problems.
Interesting. Well, let's talk about how copper toxicity is treated.
Well, copper toxicity, one of the things that I talked about was that the zinc levels are extremely important. So working with copper, working with a nutritional, the most common things that we give for copper toxicity is zinc and vitamin B6. If those aren't completely effective, we can add other different types of B vitamins. But also, along with that, we give some herbals and also some homeopathics. So homeopathics can be extremely effective in actually taking out copper toxicity. We have different, cuprum metallicum can be extremely good. We have other different types of homeopathics that are very well known to help to reduce copper toxicity. Cilantro is absolutely wonderful for taking down high copper. There are other different types of herbals that can also be used, but using those basic ones in combination are excellent for getting the copper toxicity.
So you said zinc, vitamin B6, treating it homeopathically. Cilantro.
Cilantro is absolutely wonderful. It not only helps to take out copper, but also other heavy metals too. So we use that quite a bit in our process. And then, of course, we usually check that in about 3 months on the hair analysis and see what kind of changes that can occur.
Now, what form do you find the zinc and the vitamin B6 in? Is that pill form or liquid?
We actually have both.
Okay.
With the vitamin B6, we have pill. You can, if severe cases, you can actually give a shot for that. For the zinc, we also have liquid and pill.
And we do the injections here if people need
We do
those.
the injections. So finding out exactly what works for each individual. Some of the people, of course, that we have are children. And some of them can't swallow pills, so having a liquid zinc and liquid products is extremely beneficial for them. Some of the things that, as you're talking about children, dyslexia. We've had kids who were completely cured from dyslexia completely by getting their copper and zinc balanced. It can be actually pretty dramatic. Some of the parents are just shocked at how quickly the changes actually occur in children. Matter of fact, if you're taking teenage girls and checking their zinc-copper ratios, because of all the hormonal changes that occur, it's almost 100% that there's an imbalance. It's very close. The other times
that makes sense, huh?
Yeah, the other times that you have the imbalance going on is during menopause. Mm-hmm. Anytime that there's a stress on the hormonal system, and the most common times that occurs are, when you're first reaching puberty, when you're, for a female, having a baby, mm-hmm. and then also when you're going through the changes in life. So those are times that we can get some very dramatic changes.
Right. Well, how quickly do people respond to the treatment? I mean, I've seen it over and over again, but
Sure.
pretty quickly.
It's actually, especially on an emotional level, it can happen pretty quickly. Mm-hmm. One of the things that severe depression can be caused by copper toxicity. I had a gentleman who came in who was actually on suicide watch for no apparent reason, and we started him on the products for the copper toxicity because his levels were so high, and that within 1 week he actually was taken off of the suicide watch. He says, "I feel completely different." Of course, it took a while to get the full copper toxicity, but just adding the supplements into his system changed his whole demeanor and how he looked at life. Mm-hmm. The zinc and the B6 made a dramatic change.
Wow. And, once and we talk about this all the time, your diagnostics are so important. Those are the
Sure.
blueprint to health, so you know exactly what's going on.
It's something that, first off, that we can have a objective measurement, which is very, very important. And we really try to base all of our care on scientific, evidence-based types of areas. And one of the things that a lot of patients will sit there and say, well, why do I need to do so many diagnostics?
Yeah.
That's a big question, which is understandable, but you don't know if you don't test.
Right.
And,
right.
If you miss something, then, you're not doing the full service for the patient.
And what's nice is a lot of the diagnostics we do here are covered by insurance.
That's
They're
true.
inexpensive, I feel, compared to what the alternative would be.
Absolutely. The amount of treatment and basically the failure of most treatments of these types of cases is very, very evident. So finding out the underlying problem and getting it treated is the best way to go.
Okay, when we come back, let's talk about how copper toxicity is diagnosed. Listen to the Voice of Health radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I went off one no-carb diet. A Girl Scout came to the door. She had cookies. I said, "Oh, I think you're going to win the trip to Washington this year." This'll be fine for now. Go back and get the rest of the troop.
A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Today we're talking about copper toxicity, and as we always talk about, homeostasis. And when we're talking about copper toxicity, it can be low copper, can have, and you went through a list of problems people can have with low copper, and then high copper. Now, I know when women are on birth control and have low copper, there's a high risk
of stroke
and
aneurysms, because low copper has a tremendous amount to do with the integrity of the arterial system. So, you can get some all sorts of problems cardiovascularly, and also with stroke and aneurysm if you are on low copper. So it's important, that any woman who's actually having birth control or taking any hormonal products should have their copper-zinc ratio checked to make sure that that's balanced, because if it's causing an imbalance, you can have severe problems that actually occur. Had a woman who was going through menopause, and they had put her on a hormone medication for it, and she started to lose all of her hair. And so she stopped the medication because she saw a direct correlation on that. But her hair kept on, she kept losing her hair. So we got her in, and we found a severe copper-zinc imbalance where the copper had gone really high due to the medication.
so the copper was high on her.
And the copper had actually gone high. And so we started her on a program just to take that down. And her hair all grew back. But it was, even though she had stopped the medication, which caused the imbalance in the copper and the zinc, the imbalance was still there, even though she stopped the medication. So, understanding that and getting that fixed, and it took care of her fatigue and quite a few of her health problems.
Yeah, in our first segment, you went through quite a list of problems with high copper and low copper.
Sure.
Yeah, and well, let's talk about copper and viral problems.
Yes. An interesting thing is that high copper can lead to chronic viral and fungal infections. Low zinc can lead to a lot of bacterial infections. And there's a very strong correlation along that with the immune system. So I had a young lady who came in who had chronic mono. And she had actually, been suffering with it for, where it had gone into a chronic fatigue syndrome.
So you don't just have mono one time; it can stay in your system.
Yeah, she, once you have the Epstein-Barr virus, which causes mononucleosis, have it in your system, it can stay there if you don't have the proper immune system to get that under control. So she had been basically had to even quit school. She was in high school and had to quit school for a year because of the fatigue. So she was doing it at home, and we got her. Did her hair analysis and found out that she had high copper, which would be just wouldn't allow her to get rid of the virus. So as soon as we started her on the proper nutrients, she could tell an immediate difference and was able to resume going back to school and got her life back. And, it also created a lot of emotional instability. And they were actually associating, her parents were associating that with that she couldn't go to school and all the frustration that was associated with that. But she said, all of a sudden, as soon as I started taking the products, I could feel an emotional stability automatically come in. So it was much more than that, than just her situation with the viral infection.
Yeah, interesting. And you keep going back to the copper and zinc, that ratio, keeping those balanced. They're kind of the yin and the yang, huh?
Yeah, it really does have a huge effect. And even for infertility, that's one of the major things that you look for. if you have a copper-zinc imbalance both ways, then infertility can occur. I've had a lot of couples who came in who were going through infertility, and I said, well, one of the things that would be good to check is the hair analysis, just to see if there's an imbalance on that. And many times they don't need to really go through all the extreme measures that are involved in fertility treatments. There's usually a reason for it. If it's not a physical reason, then it's usually a physiological one. And getting that balanced out, especially the copper-zinc ratio, can have a dramatic effect.
And it can save a lot of money.
Save a lot of money, a lot of time, because it's pretty traumatic going through the whole infertility. And it's oftentimes not really necessary. If you understand homeostasis and getting the body balanced out, it makes a world of difference. Matter of fact, I've had a lot of women who actually went through the entire infertility and spent, one woman had spent $80,000 trying to get pregnant, which isn't unusual. And she had actually come in for another problem. That she, going through that, there was a lot of emotional types of things, and hormones were off, and she was just trying to get well again. And we balanced out her system, and copper-zinc ratio was off, and got that balanced out. And she came in and said, "Guess what? I'm pregnant." Oh. She said after all that, I could have just done this probably and had it taken care of.
Right. And that we're talking about structure function medicine here.
Yes.
Balancing the body. And I tell people, this is not disease care. This is not a quick fix, give me a pill. Although people respond quickly. People
can respond very quickly. Yeah. But with that, she could tell an immediate difference. But, anytime she stopped the supplements, things would start to come back. So it took about a year to get everything balanced out for her. But the changes were definite on what was going on, because we kept on checking on the lab tests, and we really aren't done until the lab tests are balanced.
Right. That makes total sense. Yeah, and people need to be patient. They need to take responsibility for their health.
Sure.
It's very important for their care. You talked about copper toxicity and treating depression. Let's talk about that.
Yes, there's actually several different ways where copper toxicity can affect depression. One, it throws off the hormones, and the hormones are absolutely associated with how you feel and your mood. There's no doubt about that.
Right. Why do you keep looking at me?
I don't know what you're... Yeah, right. And then also neurologically. The function of the nervous system is very strongly affected by the zinc-copper ratio. And when that's off, the nervous system actually gets on edge. So, as we're talking about copper-zinc ratio, that has a huge effect on depression, both the nervous system and the hormonal system. Along with that, there are, there's actually effects on the other organ systems too that can be involved in that. Your blood sugar is directly related to your copper-zinc ratio. Having a balanced copper-zinc ratio has a huge effect on your blood sugar. We have a lot of type 2 diabetics that once we get their copper-zinc ratio balanced out, that we see a dramatic change in their blood sugar. So being hypoglycemic can actually be involved with that. But, when you talk about severe depression, where someone is actually on the suicidal level, the copper-zinc ratio is absolutely critical. You have to determine if that's an underlying issue, because people won't respond to even the pharmaceuticals effectively unless that's balanced out. So being up on that and making sure that that's fixed is absolutely important.
Yeah, and we're talking about a simple test, a hair analysis.
It's very non-invasive.
Yeah.
It
gives you so much information.
And it's actually very little hair. It's only a little bit of hair that's taken off the back. I did have a situation where I had a young gal who came in who had actually modeled because of her beautiful hair. And I told her that we would need to get a hair analysis on her, and we were walking into the back, and the room that we were going into, a guy who was bald actually came out at the same time. And I sat there and I said, and he just had his hair analysis done. She was a little, I caught her by surprise. And her mom goes, he's kidding.
Yeah.
She got her to laugh a little bit.
Yeah, a little scary. But yeah, I get a hair analysis twice a year just because of my copper zinc ratio. We're watching that. And and you want me to be nice. Because high copper can make you
there's really
edgy.
not that, and it's surprising. I mean, you can try to control that, but it really, once you have your body chemistry balanced out, it's amazing how much easier it is to be pleasant. When things are off, and severely off, it's just like the one of the things is the guy who was on suicide watch referred 6 people in. Who were also on suicide watch, and because he wanted them to have the same type of relief he did.
Right.
Yeah, because he really didn't want to commit,
Right.
So.
Well, when we come back, we're going to hear from Becca, who's going to talk about her daughter Erin and what she found with her copper levels and her treatment, and it's a story you don't want to miss. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what can a new patient expect when they come into your office?
The first thing is that's extremely important is the consultation. That's really where everything begins.
And that consultation is complimentary free. They can come in, and the consultation's with you, which is nice. Yeah,
the consultation is absolutely critical. Matter of fact, you can get 90% of your diagnosis just from the consultation.
Listening to the patient.
Listening to the patient, finding out what their concerns are, what needs to be done, how we can best help them. Having a good understanding of the complaints of the patient is absolutely critical for good care, and the patient knowing that we are actually listening to them. We have very thorough intake forms that are extremely helpful. Gives us quite a bit of information of what's going on into the system. After the consultation, you have to look at the diagnostics.
Okay.
You
do an
first
examination.
have to understand, where the patient's coming from, have an idea, but then you have to know, what to do, what the problem is. There is a difference on our diagnostics than from the medical diagnostics. The medical profession, as a disease care-based program, they are looking at disease states and combinations along those lines to treat the symptoms. Our basis of our care is a understanding of what is the underlying cause, finding out what that is, usually caused by a break from homeostasis. And you're going to hear that word if you're listening to our radio program.
You're going to know
every
it well.
time. Because homeostasis is the basis of our practice, and homeostasis is the basis of health, and we are a health office. That is what a structure function office is. So the diagnostics are extremely thorough, probably more thorough than what you would get anywhere else. We look at very extensive blood work. We might do hair analysis, might do some evaluation of the gut, because that's so important to one's health. We do a thorough cardiac evaluation. We do a thorough musculoskeletal exam. Many offices that even are into natural health are either just dealing with the functional aspect, or they are just dealing with a structural aspect. We are unique in that we deal with both, and both of them extremely thoroughly and extremely well.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I'm walking on sunshine. Whoa, I'm walking on sunshine. Whoa, I'm walking on sunshine.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about copper toxicity, and for our Restoring Hope segment this week, we're joined by some very special guests to share their story. Well, I'm talking today to Becca, who's been a patient with Dr. Prather way back. In fact, how long has it been, Becca?
I've been seeing Dr. Prather since 1983.
So that's longer than I've known him as his wife. That's a long time. And you wanted to share with our listeners and others, you just recently brought your daughter in. You've been wanting to bring her in for a while and wasn't able to. But kind of tell us that journey and why you brought your daughter in.
Well, my daughter was diagnosed years ago with developmental disabilities, and those we had learned to deal with. But about 4 or 5 years ago, she was diagnosed with chronic pancreatitis, which is a very, very painful condition. The doctors had indicated they had no reason, they had no answers as to why she developed this problem, but it definitely had made an impact on her overall health, and they had decided after a year after the diagnosis they were going to put a pain pump in her, and the pain pump currently contains Dilaudid, which is an extremely strong narcotic, 10 times stronger than morphine. And even though with the pain pump she still continued to have just intolerable pain. And in my treatment over the years with Dr. Prather, he had kept suggesting that I bring Aaron in and to see what he could do. He had treated pancreatitis patients, had had a lot of success with his treatment. So we finally brought her in a couple of months ago. He did extensive blood work, took hair samples, and when the blood work and the hair samples came back, it indicated that Erin has an extremely high amount of copper in her system. Now, again, we don't know why, but this copper toxicity syndrome has created so many problems with her that it's damaged her overall health. You know, it attacked her thyroid, which has had to be removed. She's had her gallbladder removed. It attacks the pancreas, it attacks the liver, it attacks the adrenal system. When you have an extensive amount of copper in your system, it's very, very debilitating to your health. So now Dr. Prather has her on a program where he's giving her herbs to reduce the copper in her system, and he's also given her some acupuncture treatments, and the turnaround in her overall well-being is remarkable in just 2 months. It's unbelievable. She's no longer complaining of pancreatic pain. Her quality of life is dramatically improved, and her overall health is much better than it's been in the last 5 years.
And that's exciting. I mean, she's been dealing with this problem for how long?
She was actually started complaining about the pain years and years ago. And being with a developmental issue, I'm not sure if they were attributing the problem to that or whether they thought she was possibly doing it to get attention. But the pain continued to increase, and she continued to become more ill. And then one doctor said, well, he couldn't find anything wrong with her. He wasn't going to continue to treat her. And within a few months, her health seriously declined. We saw another doctor. They run it through a series of tests. They kept saying they weren't sure. And finally, one doctor that treats conventionally. It said, well, she has chronic pancreatitis. No, we don't know how she got it. But unfortunately, she has it, even though there's no family history, and my daughter is not an alcoholic. So she does not have diabetes. But every time I would look for answers, when they came up with another diagnosis, they would say, well, we don't know why she's got it, but here's some more pills for it. And I've kind of reached a crossroad where I thought, I don't want pills to treat the problem. I want to know what's causing the problem.
And that's, you said Dr. Prather did extensive the blood work, the hair analysis for looking for any toxicity in the system. And I remember shortly after you brought Aaron in, what kind of changes did you see right away? I remember a trip to the zoo right after.
The changes were immediate. The first procedure he did that day, that in our first consultation with him, he said, I want to try to do something to reduce her pain. I mean, she was in excruciating pain. And so that day he said he was going to give her an acupuncture treatment, which I was familiar with, but this particular type of a treatment involved a powder. And something that was totally foreign to me, but I questioned him what was in the powder. And when he told me the ingredients, I chuckled a little bit because it contains gold, frankincense, myrrh, jade, and pearls. And everybody kept saying, how is this powder going to help? Well, again, questioning Dr. Prather further, he said the powder, the ingredients from the powder is absorbed through the skin, gets into the bloodstream. And he said we should start noticing a decrease in the pain in a short period of time. Well, within 5 hours after they had put this powder on her, she was no longer complaining. And since he's been treating her, she has a device that I use at home in addition to her this pain pump, which is a continuous flow. It's called a bolus, and when she has these really severe days, I was going from using the bolus 2 to 3 times a day to using the bolus maybe once a week. And that is a dramatic difference to me. And it's just evident how much this treatment has improved her health and how much better she's feeling. She's now more active. She's joined a water aerobics class. She's going to be joining a dance class this week. All of these things were just not even feasible before Dr. Prather started treating her.
And that's exciting. So can you keep up with her now?
No, she needs her own social secretary.
So if we have someone out there listening, that has issues like this, or someone they know or themselves that have been dealing with something for a long time, what would you say to them?
I've already suggested to several people when they've talked about different issues they've had, either with thyroid, either with hyperactivity, headaches, anything that this copper could impact. I've strongly urged them, either through this particular office or their primary care physician, to have a metals test done. Because had this been done years and years ago, had her copper been checked, I think a lot of these problems, unfortunately, that she's experiencing at this time with pancreatitis and the liver problems and removal of her thyroid and all of these issues could have been totally avoided had they taken the initiative to have this done. Unfortunately, everyone I've spoken with since this time is absolutely shocked about the issue with copper. Nobody, even a pharmacist that we frequent the store, she went home and searched online and was absolutely overwhelmed with the damage that high copper can cause. So I've suggested to anybody, whether you want to go to your family doctor and just say, look, I want a metals test done, or come see Dr. Prather. And you will be amazed at the changes that can be made.
Well, thank you, Becca, and thank you, Erin. And Erin is just a delight. We love having her, and we love her hugs when she comes in. Thank you.
You're most welcome.
Now, Dr. Prather, I know Becca's been a long-time patient. She's known you longer than I have.
Certainly.
And she's been talking to you. She talked to you about Erin for a long time.
She did.
Yeah. So tell us what you found and.
Well, she had a chronic pancreatitis and really wasn't getting any relief and was on pain medication just on a constant type of basis. And I had been telling her, to bring her in, but there was joint custody type of issues. And finally she brought her in and we wanted to first, of course, get the immediate problem under control. And acupuncture is absolutely wonderful for the pancreatitis. We have
So for the
excellent
pain,
results,
you
yes.
wanted to get her out of
Get
pain.
that under, and we use a acupuncture, acupowder in this particular instance, and got immediate response, as we always do.
Now, why did you decide to use the powder instead of acupuncture needles? Because I know there's other options.
There are a lot of different types of options, but for this particular problem, it responds much, much better. And that was just in my early days, checking out to find out what would work, and because I had a pancreatitis patient came in. And over my 30 years of practice, I found that the powder works the best. So it's a matter of experience. I don't know of anybody else who does that particular method on that, but it certainly is extremely beneficial.
So then you did diagnostics on her.
We did diagnostics, but I was already suspicious. When you actually have high copper in a ongoing type of situation, you get rings around in the eyes. It's actually a copper accumulation, and so I had seen that. So I was actually pretty suspicious that we were dealing with a Wilson's disease. Also, we had done blood work, and then the hair analysis was coming in, and that was actually showing up along those lines. And a lot of her symptoms, a lot of the things that she had been dealing with seemed to point in that direction. And we found copper tissue levels that were out the roof with the high liver enzymes, and did further diagnostics and was confirmed that it was Wilson's disease. And what occurs in that is that you have a inability to, it's a genetic predisposition along those lines, where copper starts to accumulate first off in the liver, then it spreads to the other organ systems, brain, eyes even, and can cause a world of failures throughout the system, even up into the brain functioning. So we've started a system of trying to get the copper taken out of it. We've got the symptoms under control, but as we can work with this, then we can actually start to make some definite changes in Erin. In her overall health and well-being. She's already very active once again.
Right.
Very sociable, which she, that had been lost.
Yeah.
So we're already starting to see the changes. But we would have, if this had continued, would have been a failure of multiple systems in her
Yeah,
her
because
body.
they were giving her more pain meds and.
More pain meds. They had tried to remove the gallbladder as somewhat of a help. Actually irritated the problem even more, because that's sort of a regulation of getting rid of the copper. But this was, one of her major frustrations was that she was going to 5 different doctors trying to figure out what was going on and how this could be taken care of in over several years. And, within a very short amount of time, we were able to figure it out, and I actually had an idea of what was happening.
So on
First
the
time I
exam,
on the
you
exam.
saw rings around the pupil,
Yeah, There's it's called Kaiser Fleischer rings, and what they are is rings around the eyes, and you can actually identify those and see the high copper tendency, because it's an accumulation, and it actually starts to accumulate in the eyes.
Yeah.
And that was the whole reason that she was having the pancreatitis.
Well, it's just so exciting, isn't it, that she's doing so well, and
It's very gratifying.
yeah, her quality of life has just increased, and
Yes.
she's a sweetheart. You get big hugs from her like I do.
I do. She's always glad to see me. I'm the doctor who made her feel better. So it's good that we were able to make those changes.
A neat story that we see on and on again. Well, thank you, Dr. Prather, as always. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.